Yeah, girl, I'm good. No, it's just a lot of smog out here. I don't know what's going on. The weather was so good yesterday and it was sunny, but now it's just, I don't know. It's tough air. Of course. Yeah, 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 yeah. No, my asthma hasn't been bothering me. I've been fine. I forget I have asthma sometimes. Okay, yeah, girl, I gotta let you go. I'm walking in for my cleaning. Yes, I'm very much excited. I should be good though. Okay, bye.
As the patient is walking to the dental office, we notice that the quality of air is full of pollen. This can be coming from trees, grass, weeds, and other factors. Patient is aware and concerned of the pollen and complains about it due to affecting her. This air quality can trigger allergy symptoms like sneezing, itchy eyes, and asthma.
Hello, Brittany. I'll be your hygienist today. Before we get started, we're gonna go ahead and do medical, dental, social history just to go over if there's been any changes.
Okay.
And then from there, we'll go ahead and start like the procedure.
Okay, perfect.
Okay, so I went ahead and looked over your medical, dental, social history, and I did see that you checked off on the health conditions, medical conditions, that you have asthma.
I do have asthma. Everything else is pretty much the same though, but my asthma is pretty much controlled for the most part, so I haven't really had any episodes lately.
Okay.
But I do have asthma.
Okay, so yeah. So what are like the triggers for like your asthma?
Definitely heavy pollution and
Heavy
smog.
pollution.
That's really the big one.
Okay, and lately, like yeah, like the weather has been
It's
very,
been,
very polluted.
yes,
Yeah.
it's been really bad.
Mm-hmm.
During the medical history assessment, we gather the information that the patient has asthma. Asthma is an abnormal immune response occurring in the bronchial airways. This leads to bronchi spasms and inflammation. In a dental setting, the emergency is often precipitated by hypersensitivity to triggers or inhaled allergens, which then leads to difficulty in breathing.
Okay, so one of our protocols is whenever if a patient they have asthma, then we ask them if they have their inhaler with them. Do you have your inhaler?
Definitely, it's in my pocket right here.
Okay, can I have it? Because I will place it like nearby us in case if anything triggers or anything like that.
Okay.
You feeling okay?
It's feeling a little weird, but I think I'll be okay.
Okay. Does your chest start to feel like it's tightening or like can you breathe?
A little difficulty breathing, no tightness.
Okay. We need to get the doctor.
Okay.
The signs and symptoms of an asthma attack are wheezing, dyspnea, productive coughing, and physical distress. As we can see, the patient is having difficulty breathing. We can hear her wheezing, which is a sound caused by the airway narrowing. Patient may also cough due to excessive mucus production. We can also see that the patient is under physical distress, making her sweat and having a fast heart rate.
Okay, we're gonna get the doctor so he can help us. What's going on? My patient, she's having an asthma attack. So
We're gonna, yes, please sit her up. Hi, Brittany. I'm Dr. Fatima. I'll be taking care of you. All right. Go ahead and control your breathing and just try to breathe in through your nose and hold. Okay, very good, very good. Do we have her inhaler?
yes, I just set it over here.
Okay, awesome. All right, we're gonna go ahead and administer your inhaler. Go ahead and take a deep breath and hold it in good and squeeze. Good, deep, deep breaths. Very good. Okay, and just focus on your breathing. I'm gonna grab this from you. Focus on your breathing. Let's go ahead and check your vital signs. take deep breaths for me, nice and controlled. Good, very good. How's your breathing feeling?
The necessary equipment to manage an asthma attack emergency are a bronchodilator or inhaler. The inhaler should be administered as soon as the emergency is recognized to help stop the bronchi contracting spasms. Another equipment can be a spacing device, which is a device attached to the inhaler. When the first dose of the bronchodilator is ineffective, this device can be used to ensure the medication is delivered more effectively into the lungs. Oxygen is also necessary during an asthma attack. Oxygen must be administered at a rate of 4 to 6 liters per minute to help the patient with difficulty breathing. If the bronchodilator fails, the dental office emergency kit should be on hand to administer epinephrine, which is a 0.3 milligrams of 1 to 1,000 solution delivered via syringe or auto-injector. Other important equipments are a blood pressure, oximeter, and a thermometer to monitor vital signs.
Alrighty, how do you feel? Not good? No. Okay, her respiration is 7. Okay, let's go ahead and get oxygen ready for a patient. Alright, we're gonna go ahead and put oxygen on you, okay?
Okay.
Alrighty. Alright, go ahead and administer oxygen 4 to 6 liters, please. Alright, and just take deep breaths. Deep breaths. Okay. How are you feeling?
Better.
Better? Okay, good. Take deep breaths. Respirations are now 10 respirations per minute. Good. A little better. We're gonna have you on oxygen a little bit more, okay?
Okay.
Vitals are doing good. Respirations are 12 per minute. Very good. Good. You're doing better?
Yes, thank you.
Can have you on oxygen for a little bit, okay?
Okay.
During the management of the emergency, we followed protocol with the algorithm REPAIR. REPAIR stands for Recognize, Evaluate, Position, Activate, Implement, and Refer. We recognize the patient's signs and symptoms of the asthma attack, such as wheezing and difficulty breathing. We immediately evaluated the patient's respiration rate. Then the patient was positioned upright with their arms forward to help open the airway. We activated the cabs by checking her pulse, clearing her mouth of all dental instruments to keep her airway open, and monitoring her breathing for wheezing caused by airway spasms. The emergency kit was ready in case of a severe outcome and in need of epinephrine administration. We then implemented treatment by using the patient's inhaler and helping her stay calm. Oxygen at 4 to 5 liters per minute was administered and loosening of tight clothing around her neck to ensure clear airway. The last step was referring the patient to their primary care physician.
Did you know even Olympian athletes can have asthma and still compete at the highest level? Asthma is very common. About 300 million people worldwide live with it. Some surprising triggers include cold air, exercise, and even laughing or crying. Asthma symptoms can also get worse at night because of the changes of your body while you sleep. Another interesting fact is that asthma can run in families, and it doesn't just affect kids, adults can develop it too. The good news is that asthma is manageable, and with proper care, people can live active.